Hi, everybody. This is Chris Pistorius with Kickstart Dental Marketing. Today, I've got a special guest, a great client of ours, Julie Rentz. She is the business administrator for two practices that they own, Stonegate Dental in Parker and Deer Run Dentistry. So we're going to talk to Julie today about just some overall things that have made her and her husband, Dr. Rentz, successful, and recent addition to the Deer Run Dentistry to their family. They just bought that not too long ago. So, Julie, thank you so much for coming on and being a part of the show today.
Yeah, but thank you for having me.
Of course. So why don't you just start off by telling us a little bit about your practices, how long you guys have been in dentistry and things like that.
Yeah. So our practice, we've been in dentistry. We bought our practice back in 2013. My husband's been practicing for since 2011. So got a couple of years under his belt before we kind of went into that ownership market. But we're a general practice in Parker. So we have a general practice in Parker. We just purchased a second general practice in Greenwood Village. And it's kind of been a wild ride. So we started with 3 employees when we purchased the practice. Was really part-time. I don't know, maybe 600 active patients when we bought it. And now we're at Stonegate, we're at 11 employees and we're at roughly about 2,600 active patients. So
wow.
It's grown a lot. Dr. Rentz, Dr. Rentz is what's referred to as a super GP. So he does a lot of his own work here in our office. And I think, when we originally started, he did a lot of his own procedures out of necessity. Dental school's not cheap. So we had to look for ways, we didn't have a big patient count. We had to look for ways to really keep what we could in-house. But I think that keeping things in-house out of necessity kind of has transformed into this like intentional business model for us. And it's, I think it's worked really well. And we're able to do a lot of our patients' care just here without having to send them out all of the time. We do sometimes, but.
Yeah, that's great. So in both practices, do you offer some services in one practice versus the other, or is it pretty much the same services in both practices?
Yeah, we try to keep it uniform, same services in both practices. And when we were looking for an associate for this new practice, that was kind of one of the areas that was important in our, selecting a candidate. Was we wanted somebody who could, step into that super GP role, because I think when you're in a saturated area, there's a lot of other doctors, a lot of competition, and you're dealing with insurance and insurance reimbursements. It's almost a necessity.
Yeah.
And so, and I think patients really prefer not to have to travel, to other offices. There's always cases where you have to send them out to specialists, but patients, it eliminates a lot of hassle for the patients.
Yeah, absolutely. And we find that too, as you know, when we do your marketing, most of the times, unless you're a specialist, most of the times in a densely populated area, most of your patients are going to come from kind of a 5-mile radius, just kind of depending on the market. And it's out of convenience, and it's out of convenience from their home or from their work. So, yeah, I think you're spot on there. Talk to me about when you grew enough and you decided to go ahead and purchase a second practice. How did you kind of come up with maybe writing out kind of, all right, this is how we run Stonegate. This is kind of our standard operating procedures. Let's duplicate what we're doing here, and then bring that over to Deer Run and just kind of set it up how we have the current one set up. Does that make sense? Is that kind of how you approach it?
Yeah, ultimately, yes. Once we got into the practice and you kind of start to get a feel for the patient demographic and how things had been done. You start looking at ways to either modify some of those procedures to be individualized for that practice, or sometimes I say, no, that's not how it should be done at all, and we just scrap it and put our procedure in place. But yeah, I think especially in private dental practices, I know there's a lot of really great private offices, very successful, but so common, the administrative side, that the standard operating procedures, I think clinically they all get special training for that. And so those are all to some degree pretty like standard protocols, right? But administratively, somebody has to put those in place. Somebody has to work to put those together and train everybody. And I guess I'm always surprised at how many offices don't take the time to do that, because I feel like that in and of itself it makes bringing on employees that much easier. It makes knowing how to handle situations, kind of a step-by-step guide. Those are really, I think, vital to the operation of the office.
Yeah.
And then being able to just change the logo and take it to the next office has been a huge advantage.
Yeah, and there's a book out there. I don't know if you guys have read it, but it's called E-Myth Revisited. And
yeah, I have.
So it talks a lot about, not just about dentistry, but it talks about how to scale a business, and it talks about you got to really have a map of, standard operating procedures, and, instead of working in the business, you should be working on it kind of at a high level. And it talks a lot about processes and procedures. And I think if you're looking at growing a dental practice and buying one or even more practices, I think what you did is exactly right. You've got to have those standard operating procedures. We know what works. We know what doesn't from our years of experience. And then I don't want to say cookie cutter, but that's probably the wrong word, but, it's kind of that mind frame of, I think it'll just help you expand the business quicker and get up and running, as fast as possible.
Yeah.
Yeah. Well, awesome. So talk to me about, obviously with marketing, what do you think is your unique selling proposition at your practices? So this is like, obviously we all know that there's a lot of competition in dentistry. What is it? Why should people go and visit your practices versus maybe somebody else's?
Well, I think ultimately it's that comprehensive model. I think that what sets us apart, and the feedback we get from patients so often, is that they build a relationship with Dr. Rentz. They trust him. And so they want him to do their work. They don't want to have to go to a specialist. Sometimes patients will be saying, no, can you just try? Can you just try? Instead of sending them, and, puts them kind of in a difficult spot. But I think that model, and to be honest, I didn't realize that it was a model until we started interviewing other dentists and realizing other dentists don't do all of this stuff. They don't like it, or they just don't feel confident. They don't get the continuing education in it. So I didn't really realize that this was fairly unique for us. But I think that's ultimately what sets us apart, that the patient can come in and get their endo, they can get their oral surgery, they can get their hybrid, they can get, whatever process they're doing here. Yeah,
no, that's awesome. Again, it kind of, I don't want to bad words again, but kind of a one-stop shop, but people are looking for convenience and, trying to get most of their needs from one place. So that totally makes sense.
And I think another piece to that is maybe instead of one-stop shop, Dr. Rentz ends up quarterbacking, maybe is a better word, that care, right? So if that patient has to go see a specialist, we're not just sending them. He is involved, and which I think is common, right? I think doctors do tend to be aware of where their patients are going and when, but it's a little different when he's actively involved in that that case.
Yeah, right. And kind of going back to, because I know that we've got several clients right now are actually looking to potentially expand and buy another practice and kind of go through what you've just gone through. And I guess kind of overall, what are some kind of major tips or advice that you would give somebody that's looking to maybe add on to their practice? What are some of the big things that you went through?
So, well, I think we had, in some ways it was a huge disadvantage, and in some ways it was an advantage. Is we bought our practice literally on the day we all had to close down for COVID. We closed the practice on March 18th, and March 19th was when they all said everyone shut down. So, of course that was not ideal at all, buying a new practice and then having zero income for the next, I think it ended up being about a month and a half, 2 months. But at the same time, it also gave me a lot of opportunity to really dive into their office systems, seeing, like their billing and how they were scheduling things and how they had things set up in the system. So for me, I thought it was going to be as easy as taking my processes from this office and transferring it over to that other office. And that definitely was a huge advantage and helped a ton. But I think there's also the employee side, having to try and be in two places when both offices need me that's the challenge. And so I would say make sure that you have a office manager in place before you buy that practice. If you're bringing, if you buy the practice and it comes with one, great, but you need someone who can be you, basically. You need someone who can yes, and is keeping a very watchful eye over, especially those first few weeks. They're very kind of crucial in transitioning the patients to a new provider. And, I had to do a lot of phone conversations with patients who just weren't sure that they wanted to try the new doctor. And I think having the availability to be present.
Yeah. That totally makes sense. And I think, it is very important to have, a very strong office manager in any practice, but especially when you're expanding and adding practices, and you just got to make sure you've got somebody there that can take accountability, can take charge, can handle the smaller stuff. And then that's really what puts you in multiple places at one time. Right. So I think that's very important.
Yeah. And I think for me, that has been the number one struggle is personnel and having someone there. And so if I were to give somebody advice for going into this type of buying a second practice, it would be to have that person that you really know and trust, knows how you like it done, knows how to get things set up right, and get the ball rolling.
Yeah. And I think this is a good segue into, many practice owners and managers, talk to us about staffing and, how it's difficult to find people and quality people and get them to stay. And they want to avoid this cycle of hiring somebody, then they leave and they got to rehire and start all over. And, I think when you expand practices, you have to look at probably the existing staff that they have. And did you put them through an interview process, or how did that work? And what are some tips that you have on hiring and firing?
Yeah. So our situation was unique because we were closing, we actually did not rehire their office. So some doctors may not know this, but when you buy a practice, those employees essentially become brand new employees on the day you buy the practice. So their employment is not an automatic through the purchase. It's very common. I mean, it's highly suggested that you keep the current staff, but for us, we knew we were going to be closed for a month and a half. I had done some due diligence on the practice and kind of seen some of the way that things were being handled clinically, and I kind of went back and forth. Do I keep them and try to retrain them? I think that that's difficult. Or, we're going to be closed for the next 2 months. Do I just not rehire them and build my own team? Because I've got the time, right? I don't have any patients that I have to see. And so that, for us, that's what we opted to do. We didn't rehire their staff, and we built our own staff.
Okay.
I think, yeah. So, but I think, like finding the right employee varies by owner, right? What I find value in and what another owner finds value in could be different. But for me, the three things I first look for in a candidate is their personality. Then I look to see, are they trainable? And then I look to see, do they want to grow? Because I feel like so often dental employees, so first I think dental employees, because of their experience, tend to get cycled through offices, but aren't necessarily good employees. But they get hired, they constantly get rehired because they have experience. And I think that it's almost like a setup to fail if you just hire somebody because they have experience. I think one, personality you can't train, so I think that has to be there. Two, when I say I need that person to be trainable, I need them to be trainable, whether they've had 10 years of experience or whether they have no experience. Because the reality is that every employee that you hire requires training, whether it's to your specific processes or just determining. I mean, in interviews, every candidate is going to tell you they know how to read an EOB. Every candidate is going to tell you they know how to, talk to patients about insurance, how to present a treatment plan. They're going to tell you they know how to multitask. Just kidding, I'm exaggerating, but because, and in their minds, they really do think they know these things, but you get them on the job and you realize they only know what they've been taught in the past or trained in the past. And if that's either incorrect or not your way, every employee you ever hire is going to require training. And so, if that candidate seems like I know what I'm doing and I'm, not open to feedback or training, it's like a no-go for me from the start. And then lastly, I think so often these dental jobs, not necessarily for clinical employees, I still think all of these things apply for clinical employees, but I want an employee who views this position as a career, not just a job. I think viewing the position as a career means that they're constantly looking for ways to grow in that position. They're constantly looking for what they don't know and how to get better and how to move up. And that only benefits my practice. If I've got somebody who has the drive to want to be good and do better, that's my ideal employee. Those three things, and I feel like everything else is trainable. Yeah,
I think that's a great plan, and that's great advice. And it's I think this whole COVID thing has maybe increased the talent pool a little bit. Maybe there's more qualified people available, but I'm hearing more and more about dental practices hiring not necessarily with no experience, kind of like what you were addressing. Some practices like to hire people with no dental experience because they feel as though then they can train somebody just the way to their their customs and their procedures, and there isn't kind of this already set in their ways type attitude, and they seem to be. But I think that the thing is they have to be coachable and they have to be trainable. And They have to be willing to learn.
Well, and on the employer side, the employer has to have systems set up to train that employee.
Right.
So, I mean, a lot of times they just stick them in the front and kind of train them as they go. But the reality is, especially in dental and in healthcare in general, there's so much you have to know, from insurance, how to code, dental terminology, insurance, how different plans apply. Billing, you have to know accounting. There's just such a wide range of information that you have to know, that if an employer hires somebody without experience and doesn't have a system in place to adequately train that employee, you're going to get out of it what you put into it.
Yeah, I think that's great. Yeah. Okay, well, I'm going to start wrapping up here, but I'm curious, you just brought on the additional practice. Where do you see your practices in the next 5 years? What are some of the goals that you want to accomplish?
Yeah, so the Deer Run office that we bought actually is in a very similar situation to where Stonegate was when we initially bought Stonegate. So in a way, I think Dr. Rentz and I are hoping that we can replicate that success, which I think is every doctor who buys a second practice, I think that's their goal, right? They want to replicate their success at their existing practice. So in 5 years, I'm hoping that Deer Run will be seeing the same type of growth that we've been able to see here at Stonegate.
Right.
For Stonegate, we're definitely going to have to be in a new building. We've kind of taken off. Our growth has taken off over the last several years, and we've just outgrown the space we're in now. So I think the next step for us is getting into a bigger building so that we can continue that growth.
Nice.
And honestly, I think just continuing to improve our patient experience. I don't see any changes necessarily to our model or things like that, just kind of what we can offer to the patients and the experience we can offer to the patients.
Yeah. Well, that's awesome. And, I know that Deer Run's going to be just as big a success because you have such a great, internal organization. Dr. Rentz is awesome. I know his patients love him. And with you kind of running the show behind the scenes, I think that's just a recipe for success. So I think what you've talked about, and maybe once you move into the new building, that'll be our next segment. You can teach everybody what the best practices for moving are.
Yeah. Oh, I was just going to say, luckily I've got a good group of other dental spouses behind me who, have all kind of been through this, and they give great advice and great checklists. So. Yeah.
Well, awesome. Well, Julie, I appreciate you taking the time. I know how busy you are, and I really appreciate you coming on. I know anybody that's going to watch this will get a lot of value out of it just from your experiences. So thanks so much for being with us today.
Yeah, thanks for inviting me. I appreciate it.
Of course. That's it. Thanks, everybody. Right. And be sure to tune into our next segment. Thank you.